Oh, thank you.
I'm very pleased to here to present AB 2151. It was really a committee bill which adjusts the benefit, delivery, and verification of the CalWORK Special Need Allowance to better support low-income families with children managing hunger, nutrition, and medical conditions. This bill does three things. First, it increased the benefit from $10 a month to $20 a month, or the actual verified costs incurred by the family. Secondly, it allows a greater range of healthcare practitioners to verify need. And third, it delivered the allowance as a supplemental food benefit rather than cash. Going hungry is a major contributor to ill health, especially among individuals suffering from chronic illness that requires patients to adopt strict dietary measures. The current supplement allotted to CalWORK recipient with special dietary need does not meet the need of California poorest family. By increasing the benefit to account for the more realistic cost of nutrition for those with sensitive medical conditions, food allergies, or food preparation needs, we can prevent long-term medical complications for our most vulnerable. Changing the allowance from the cash aid to a supplemental food benefit ensures that we're not inadvertently reducing the nutrition assistance family receive through CalFresh by increasing their countable income. This bill is also important because it addresses changes in our healthcare delivery system that make it difficult for poor households that use Medicare and struggle to find a provider in their community. Many of those recipients receive care from other qualified health professionals, such as physician assistants or registered dietitians. Opening up the verification process to the full range of providers that provide CalWORK's beneficiaries with care related to their dietary need will reduce barriers to accessing those supplements. The analysis includes a technical amendment to clarify that food preparation needs will remain a cash benefit, and the special diet-related food need will become a supplemental food benefit, and we are in conversation about additional amendment related to the qualification of the health providers verifying special dietary need. AB 2150 provides simple solutions to improve the support we offer to low-income families with children that are struggle to make ends meet, and I ask for your I vote. Today I have with me Eva Ho Rushmore, representing the Women's Policy Institute and co-sponsor of this bill with the Western Center of Law and Property, and Jonata Hall from the Women's Policy Institute here to testify. Thank you very much.
Thank you so much. Witnesses in support.
Hi, my name is Janetta Hall. I'm 40. I have an 8-year-old daughter. I was here before about Cal Jobs Bill 2508 with Senator Bonita. Well, I am here today to explain 2151 that my daughter suffered from a stomach intestinal blockage, and she is on a strict diet to stay away from dairy products, period. So we supplement that by getting more vegetables and fruits. She cannot have milk, yogurt, cottage cheese, macaroni and cheese, which is her favorite. We have to travel a ways to get our food to get reasonable prices. We buy our meats and canned goods first, then knowing cost of canned goods have went up. They used to be 60 cents to $1, now $2. I and she can only digest certain meats, so we have specialty diets. We shop once a month with ride and other times walk or ride bus to get to the stores. I have to make sure that her system stays able to let her go to the restroom that we call number 2. She has to have, she cannot have certain foods that have milk in it or it gets her sick and we end up going to the hospital. So she was told to not have any dairy products. So I supplement that by just going to the store, buying her fruits and vegetables, and the costs for those things are high now. So it's very hard for us to make sure she's getting adequate vegetables and stuff to help her go to the bathroom because of the blockage. She has a hard time going to the bathroom. So we do our best to just keep her on vegetables and fruits. And I'm just here to support 2151. I'm hoping for your aye vote. Thank you.
Thank you very much. Other witnesses in support?
Thank you, Janetta. Good afternoon, Madam Chair and committee members. My name is Eva Holt-Russmore, and I'm here to urge your support to AB 2151. I have a decade of community health programming experience, and I know that this bill will help California's low-income children and their families who have health conditions that require special dietary needs. I ran a food bank nutrition program that served thousands of families, many of whom received CalWORKs benefits, and we're grateful for the fresh foods that we provided. Sadly, many of those in this program were impacted by diabetes or other diet-related diseases. Without the fresh foods from our program, they would never have been able to follow their health professionals' recommendations because the cost of healthy foods is prohibitive. Management of illness can have other costs as well. For example, individuals with special dietary needs may have food preparation costs, such as gloves for autoimmune diseases or thickening agents for people with liquid diets. The lack of access to foods needed to manage health has dire consequences to an individual's well-being, but also to the state. Most people who receive CalWORKs receive health care coverage through Medi-Cal. And annual medical spending for people with diabetes is twice that for people without diabetes. We have a responsibility to manage the healthcare costs by implementing prevention measures, such as the special needs supplement. By providing people with modest help to accessing more healthy foods, this bill helps better manage their health and reduce their use of the healthcare system. Another important impact of this bill is allowing qualified health professionals, in addition to physicians, to verify necessary dietary needs in order to receive this supplement. Many CalWORKs recipients receive non-urgent care from nurse practitioners and dietitians who are qualified to manage their health care needs and manage their patients' diets. In light of California's shortage of medical physicians who, physicians mandating that only physicians can verify this special diet places an undue burden on individuals who are trying their best to manage their health. This bill provides a simple solution to the burdens faced by low-income families and children. I urge an aye vote for AB 2151.
Thank you. Others in support? Please just state your name. Yes, did you have something you wanted to add?
Yes, due to that, the doctors will have to sign off on the bit to get the supplement. My daughter is under doctor's care for her condition. Thank you.
Thank you. Yes, in support, name and organization, please.
Madam Chair, Mike Carroll with the Western Center on Law and Poverty. We're co-sponsor of this measure. We're glad to support it. Thank you.
Hector Gutierrez from California Food Policy Advocates in support.
Thank you.
Deneen Micheletti, representing the California Alternative Payment Program Association, in support.
Andrew Shane, California Association of Food Banks, in support.
Shazia Munji, representing Physicians for Social Responsibility Los Angeles, in support.
Stephanie Fahuri, representing the Disability Rights Legal Center, in support.
Sam Martinez with the National Association of Social Workers, California Chapter, in support.
Thank you very much. Anyone in opposition?
Thank you, Madam Chair. Eduardo Martinez with the California Medical Association. We are in an opposed or less amended position, but we would like to work with the author and the sponsors and the committee moving forward. So we definitely support the bill moving forward today. We just want to work on some fine-tuning of the language. We want to make sure that the providers that are granting the special needs, are signing the verification, are qualified to do that. We read the language as essentially allowing various types of providers to grant the special needs allowance after a certain medical procedures, which they may not be qualified to do. So we're going to work, fully intend on reaching a mutually beneficial conclusion. Thank you.
Oh, you're making me feel like I'm back in B.
Well, exactly. An issue you're very familiar with. Yes, Madam Chair.
Protect that scope. Okay, seeing no other comments from the public, I think we have one other witness. What's your name? You came today.
My name is Kayla.
Kayla. And are you in second grade, Kayla?
No, I'm in third grade.
You are in third grade. And what's your favorite class in school?
I like doing math.
That's great. Well, I hope you go back and tell your class that you came to the state capitol and that you spoke in favor of this very important bill, and that your teacher gives you some time to talk about how you were involved in government. Thanks for coming today.
Thank you.
Seeing no other public speakers, I don't see any questions. So Mr. Thurman.
Thank you, Madam Chair. I wanted to thank the witnesses for their great testimony, and our future Assembly member, Miss Kayla, who was here today. Nicely done. Or future State Treasurer, mathematician extraordinaire. I just wanted to ask about special diet provisions, and if a family member or child has a gluten-free, has a celiac disease or an allergy to gluten, would that kind of thing be included? And just wanted to understand how the allowance would work, because as a parent of a child with a gluten allergy, it's expensive. And I want to make sure that we do this in a way where we actually give our families enough money to work with to address whatever the special need is.
Great. That's a good question.
So the bill is for any recommendation by a physician or a qualified licensed health professional. So that's the language that we're trying to work towards. So if your child has a celiac allergy that they would need a special diet specific for, and I know that some of those diets are very extreme, so sometimes you need completely separate food preparation areas. They need to have completely separate meals from the family, so obviously that is a burden on the families, and physicians would recommend something like that.
I thank the author, and I would move the bill, Madam Chair.
Thank you. We have a motion and a second. This is a do pass as amended to appropriations. And with that, we will take the roll.
Bonilla?
Aye.
Bonilla, aye. Grove? Calderon? Lopez? Aye. Lopez, aye. Mainshine? Stone? Aye. Stone, aye. Thurman? Aye. Thurman, aye. The bill is out.
The bill is out 4-0. Thank you very much. We will also entertain a motion on the consent calendar.
Thank you.
Thank you.
Thank you.
Mr. Chu. And the consent calendar includes AB 1679, item number 3, AB 1688, item number 4, AB 1712, item number 6, AB 1797, item 9, AB 1849, number 12, and AB 2054, item number 17. We have a motion and a second. Please take roll.
Bonilla?
Aye.
Bonilla, aye. Grove? Calderon? Lopez? Aye. Lopez, aye. Mainshine? Stone? Aye. Stone, aye. Thurman? Aye. Thurman, aye. It's out.
Thank you very much. It's out. Mr. Dodd, you're next. And Mr. Dodd has AB 1667, item number 2. Thank you for joining us today. We'll let you get started. They'll join you.
They'll be here sooner.
They can figure out how to get to the front.
Madam Chair and members, good afternoon. I'm here to present AB 1667 pertaining to home care worker background checks. As California's senior population grows, there's an increasing need for in-home care to facilitate individuals' ability to live comfortably in their own residences. Home care aides play an important role in meeting this need by providing a breadth of non-medical services to elderly individuals and individuals with physical and mental disabilities. These services can include assistance with cooking, cleaning, dressing, feeding, bathing, and other typical daily needs. In 2013, the governor signed the Home Care Services Consumer Protection Act. That bill provided for the licensure and regulation of home care organizations that directly employ aides and establish the registration of home care aides who are directly employed by these organizations. Under this act, home care organizations must ensure that staff have received background clearances, been screened for TB, and have received a minimum amount of training prior to providing care to a client. The act, however, did not include referral agencies. Referral agencies are a form of an employment agency that refers home care aides to prospective clients, but does not directly employ the aides and is not permitted to train, supervise, or monitor the care provided, nor provide any tools, equipment, or supplies to the aides. Both the employer-based home care organization that employs workers and the home care referral agency models that refer independent workers are legitimate resources for clients seeking home health care services. Closing this loophole is needed so consumers know that both models are licensed and are required to provide comparable consumer protections. It is appropriate that consumers enjoy a consumer protection standard applied to the whole industry, not just part of it. Let me acknowledge the committee's suggested amendments on page 6 and 7 of the analysis. I'm happy to accept these as author's amendments, but as discussed with your consultant, Madam Chair, I'm requesting the opportunity to work with you on fine-tuning these additional requirements so that they work with all parties.
Yes.
Here with me today is my former colleague of many years, Napa County Supervisor Brad Wagenknecht, and also here is Melissa Chapman on behalf of the Network Domestic Referral Agencies.
Thank you so much. Witnesses in support.
Yes. I am Brad Wagenknecht. I'm on the Napa County Board of Supervisors, and this is something that Assemblymember Dodd knows intimately because he helped craft this from when we did it in Napa. One thing is for sure, we all want the same thing for our loved ones, to provide a safe environment and best quality of life for them. That is why we need to put the protections like AB 1667 in place now before our loved ones are harmed. About 10 years ago, Napa County staff and the Commission on Aging began working together to form a response to patterns of elder abuse we were seeing. These crimes against our loved ones were being perpetrated by caregivers who were not properly vetted by family members in private agencies. Elderly who need care are often described as children with assets. These assets are the senior's vulnerability, and the senior's vulnerability makes them attractive targets for unscrupulous potential caregivers. And most of the crimes we saw involved financial abuse of elders, much more than physical abuse. The patterns we saw included coercing victims to write checks to caregivers, forging checks, caregivers stealing valuables out of the house, and caregivers in the form of victims' adult children who moved in and didn't pay any bills and put their parents at risk for losing their homes. We cannot see what goes on behind closed doors, so it is very difficult to regulate what is happening until it gets out of hand. There was no caregiver screening program we could turn to, so we decided to be proactive. We wanted to screen out the unscrupulous people who had a chance to harm our most vulnerable citizens. Napa County Caregiver Ordinance passed May 2010. It was the first ordinance in the state to mandate individual caregivers must have a background check and obtain a county permit before they can work as caregivers. The definition, individuals included adult child of a person needing care who receives compensation for that care, like free rent. It mostly meant any individuals, a person hired by a family, individuals that may have met through friends or other situations. Our ordinance also covered businesses that provided caregiver worker. At the time of the ordinance, we did not realize that the referrals of or referral agencies were not covered under the definition of the caregiver businesses. On January 1st, 2016, the state took care of the regulation of businesses and provided caregivers for elderly people. So we are very grateful to Assemblymember Dodd has put forward AB 1667 and will close the loophole and cover referral agencies as well. This is a very large and critical step in our protecting our elderly loved ones. In closing, I urge you to support AB 1667 and ensure our elderly loved ones do not suffer needlessly from unscrupulous opportunists and are able to live out their days in peace, safety, and dignity.
Thank you very much. We do have a motion and a second. Other witnesses in support?
Hi, my name is Melissa Chapman, and I represent the Network of Domestic Referral Agencies. We appreciate and thank Assemblyman Dodd for authoring this important bill. Consumers needing home care services should have the peace of mind knowing that regardless of whom they turn to receive those services, that the home care workers have been vetted and that the company they use is licensed, regulated, and under the oversight of the state of California. Licensing only one segment of the home care industry is confusing and misleading to consumers. AB 1667 provides for important consumer protections. It requires licensed home care aid domestic referral agencies to use only workers that have passed a Department of Justice criminal background check and are listed on the Department of Social Services Home Care Aid Registry. It also requires these agencies to carry liability insurance, to report known or suspected elder abuse, and ensure that home care aides are regularly screened for TB. Different consumers have different needs. Sometimes a home care aid domestic referral agency will best meet those needs, and sometimes a home care organization will. Having multiple business models to choose from greatly benefits the consumer and provides them with the ability to choose the option that is best for their unique needs. Regardless of which business model the consumer chooses to use, they deserve the protection and security knowing that the company and home care workers meet the consistent standards mandated under AB 1667. Home care aid domestic referral agencies provide a high degree of flexibility for both consumers and home care workers utilizing their services. Consumers retain the right to choose which workers best suit their needs, and workers also have the ability to choose which clients best suit their needs. Consumers aren't required to use more hours of service than they need or want, or for a longer period of time than they'd like. Home care domestic referral agencies are often turned to for short-term help when a caregiver or family member is temporarily unable to be there, playing a vital role in the continuum of care for our seniors. The licensing and regulation of home care domestic referral agencies will ensure that consumers continue to have choice and flexibility without having to worry about whether the company they receive those services from is licensed and regulated. We respectfully ask for your support.
Thank you very much. Anyone else in support? Public members in support. Name and organization. Thank you.
Madam Chair, members, Ted Toppin for the California State Retirees in support for the reasons that have been well articulated.
Thank you.
Greetings again. I'm still Fran Smith. I'm representing for this bill the California Alliance of Retired Americans. Thank you very much.
Thank you.
Hi, Jay Bloodsworth with the Better Living Home Care Agency, and I support the bill.
Thank you.
Hi, Stephanie Sales with ARP Home Care, and I support the bill.
Thank you.
Hi, Janae Dodgens, and I have businesses here in town, home care referral agencies, and I support the bill.
Thank you.
Ray Liu with 1+1 Senior Care, a domestic referral agency, in support.
Thank you.
Matt Mukuyama with 1+1 Senior Care Referral Agency in full support.
Thank you very much. Those in opposition?
Good afternoon. My name is Michelle Rogers, and I'm the owner of Home Instead Senior Care, serving the South Peninsula with about 130 home care aides, and I oppose this. The reason I oppose this is because I've seen over the 9 years a lack of transparency, a lack of disclosure, and so when a 1099 comes into the home and it's not disclosed by the agency, family members don't understand that they have a person in the home and your mother is deemed the employer. I know somebody that had this happen to. Home health aide was injured, and a couple of years' worth of medical bills were incurred. So really, we fought last year. We need disclosure. We need transparency. But until then, I oppose this bill.
Thank you. Anyone else in opposition?
Stacy Dollar with Around the Clock in Bakersfield, California. I oppose the bill as well. AB 1667 is there's a lot of blur to actually the definition between a home care aid organization and a domestic referral agency. This is possibly going to cause some confusion for the consumer themselves that is seeking out care as into the differences between the two. A home care aid, we became licensed as of January 1 of this year. And the licensure we were completely in support of as into the regulations that were put in place. This basically put all the home care agencies out on an even playing field. The DRA being licensed under the home care aid registry is a little bit different as into certain aspects of it. Under our guidelines, we also have guidelines that we have to abide by as into state, federal, and labor laws. Those were put in place in addition to the home care aid organization licensure bill. The DRAs surpass those requirements as into state, federal, and labor laws due to them utilizing independent workers to provide that care out into the home. So there are still, as was said before, that employee is receiving a 1099 at the end of the year, so is that employer as well. They are unknown of some of those items that are required by them outside of just hiring that individual and paying that individual for the care. So due to those factors, I am in opposition of the bill, as well as us being licensed as of this year. Department of Social Services is already overwhelmed with what's going on in our industry alone. I don't feel that this is probably the right time to be adding additional caseload when we are trying to figure out what's going on under our own licensure as well.
Thank you very much. In opposition?
Good afternoon, members. Braden Obrowski, Policy Director, CASA. This is the third time you guys have heard this bill, so I'll just be real quick for you guys. When licensure came up, we very much supported licensure. We wanted to ensure that our organizations properly trained our individuals, that we properly background checked them, that they were TB tested, et cetera. Excuse me. That's a very important position for us. While our official position is opposed unless amended, we feel this way because we agree all workers should be put on the registry prior to going into someone's home. They should be background checked. They should be properly trained. They should make sure that they're free of TB, et cetera, et cetera. With the DRAs, this license grants a state authority to hold DRAs responsible for ensuring that they meet these requirements. But as the DRAs are not the employer, what recourse does the state actually have? Finally, I'll finish with really quickly, as you know, we just got licensed as of January 1st. We're now basically at April 1st. Let me give you some numbers. 0 home care organizations have been licensed at this time. 0 in 3 months. Out of over 81,000 individuals that said they would apply for licensure, only about 28,000 have been licensed at this time. The department is doing a fantastic job, nothing against the department, but they simply can't meet the demands at this time. We would ask that this bill be held off and we can adjust this in the future when we get through this initial implementation period. Thank you.
My name is Charles Symes. I'm the owner of Allegra Home Care, a full-service home care agency. We're waiting for our home care organization license. In opposition of AB 1667 for the fact that independent contracting folks and domestic referral agencies are not the employer, and they do not have the luxury of AB 241, which was Tom Amiano's bill. So wage theft is rampant with domestic referral agencies. Overtime, none of that is applicable. There are no requirements on how employees are paid. And so that's all diverted to the consumer who may or may not know that they are the employer. Again, in direct opposition for anyone who's listening today, 1667. Thank you.
Christina Mendez, Associate Director of Match Caregivers, strongly oppose this bill.
Kathy Gianzi, owner of Match Caregivers, also a nurse and a mother and a senior, and I strongly oppose this deception bill. They should not be licensed. It's a sham.
Candy Smith, Homestead Senior Care, Napa County, strongly oppose.
Is there any questions? Yes. Mr. Assemblymember Dodd, you want to close it?
Yes, I would love to. First of all, what we're hoping here at the end of the day is that anybody there is an assumption by many seniors, any of them that are getting referrals from agencies for home health care are already vulnerable just by the fact that they're asking for these referrals. And what we're asking at the end of the day, what this thing really does, is to make sure that every person that goes into every one of those referrals has the background checks to make sure that they know what's happened in these people's previous life. So with that, I just respectfully ask for your aye vote. And
Thank you for your presentation, but at this moment we don't have a quorum, so we're going to hold that until we have the rest of the members. They have an emergency to another committee for the health.
Thank you very much.
Thank you.
Thank you.
Okay, next we have Assembly Member Burke, AB 2346.